So why I brought in preconception care in a long-term consequences is, if a woman is well prepared before her pregnancy and she is psychologically and physically, you advise her regarding how she should take care of herself during pregnancy, it is very easy for her to continue this the follow-up after delivery, so that the long-term consequences, which I'm going to tell you further, are going to be minimized. So what we need to understand, that pregnancy is a state where it is not only the mother, but it is also the fetus which is affected. So there are many diseases. For example, now we talk about polycystic ovarian syndrome. So when we are talking to a woman who is having PCOS, we have to go back to her mother's obstetric history. We look at whether what has been her status, whether was she a growth restricted fetus, was she having her siblings which are affected by PCOS? Is she having something like was she born low birth weight, but then there was been a sudden spurt of weight, which makes the possibility of PCOS worsen. So, and not only that, suppose you see a young adolescent coming to you with excess body hair, that is hirsutism. It is again important that you look at the pregnancy maternal androgens. Exposure of maternal androgens to the fetus can cause her hyperandrogenic symptoms in the fetus. So there is an impact on both the mother and the fetus. So as far as the mother is concerned, there are two schools of thought. One school of thought says that it is an opportunity where you are looking at those diseases. It's a mirror. You're just what is going to be a future medical status. That's a pregnancy is something like a mirror where you can pick up those diseases which is likely to be getting in the future. So take the opportunity, take advantage of the pregnancy condition and any disease which you are identifying in pregnancy. Please insist on the woman for a proper follow-up in the postnatal period and for years to come, so that she will be having early identification and she will take the necessary precautionary care, for example, whether it's diabetes or hypertension or any other issue. So she will be able to concentrate on her disease and make her lifestyle accordingly, so that she will be having a minimal consequences of her pregnancy on the long term. This is one school of thought, that they take it as a window of opportunity pregnancy, where it is reflecting the future medical career of the medical life of that particular woman. And it is you have to take you have to advise her as a physician to see that she will be getting the best of care in the after her delivery also, so that she will concentrate on her health with a particular disease in the long-term perspective. Then other school of thought is that pregnancy exacerbates certain conditions. Yes, there are certain conditions which may be exacerbated in pregnancy, but is it because there is already a pre-existing condition which is again provoked in pregnancy because of the hormonal changes, or the hormonal changes themselves are causing any added changes which are not needed for that particular woman? This is a difficult question to answer, because we do not know how her medical history would have been if she wouldn't have had, for example, suppose she would have had a preeclampsia. If she's already having a vascular, especially if it is early onset of preeclampsia, we believe that it has been already an existing vascular changes which have been there in her, which have been exacerbated in pregnancy, and there is these vasospasm or the small thromboemboli or the clotting factor changes, whatever it is, they're all, or the inflammatory markers which are changing in pregnancy, both the pro and the anti-inflammatory markers, they are all changing in pregnancy. Whether these are due to pregnancy or already pre-existent is a very difficult question to answer. So whatever it is, we need to take this